Nurse Paul, I'm concerned about the recent medication errors that have occurred on our ward. We need to identify the root causes and implement measures to prevent future incidents.
That's a serious issue, Mihira. I agree that we need to take steps to improve our medication administration practices.
What do you think are the main factors contributing to these errors?
One possibility is inadequate staffing levels. When we're understaffed, it can be difficult to ensure that medications are administered correctly and on time.
That's a valid point. We'll need to advocate for increased staffing levels to address this issue.
Another factor might be the complexity of medication regimens. Some patients are taking multiple medications, which can increase the risk of errors.
You're right. We should consider implementing a standardized medication administration system to help prevent errors and improve efficiency.
Mihira, we could also provide additional training and education for staff to enhance their knowledge of medication administration. Mihira, I want to walk you through the process so you know exactly what to expect. It's a very straightforward single-visit appointment. When you come in for the vaccine, we'll first perform a pre-vaccination blood sugar check. This is a quick and simple test, especially important for you, just to ensure your levels are stable before we proceed. After the vaccination, we'll also do a post-vaccination blood sugar check to monitor for any immediate impact, though it's usually minimal. The vaccine itself is given as a small injection, typically in your upper arm, and it's over very quickly. Now, it's normal to experience some mild side effects as your body builds protection. You might feel a little soreness, redness, or swelling where you got the injection. Some people also experience a low-grade fever, headache, or muscle aches. These are usually mild and should resolve on their own within a day or two. To manage any discomfort, over-the-counter medications like paracetamol are very effective. You can take them as directed on the packaging. What's really important to remember is that these side effects are a sign that your immune system is responding and building protection against the flu. However, if your symptoms seem to worsen significantly, or if you develop any concerning reactions like severe difficulty breathing, a rash, or persistent high fever, please contact us or your doctor immediately. While serious reactions are extremely rare, it's always best to be cautious and seek medical advice. Do you have any questions, Mihira?